Well, it's not a painful procedure. Typically, we just use numbing drops on the surface of the eye. LASIK involves a treatment to the outer 1/10 of a millimeter of the eye, so it's very superficial. There are no injections. It's just numbing drops which numb the surface. I've had the procedure done as well. It actually is not a perfectly comfortable procedure. Obviously, you've got something holding your eyes open, but it's not painful. Typically afterwards, there will be about 3 or 4 hours of stinging as the eyes heal. So during that period of time, it's best to keep the eyes closed, go home, rest, get some sleep, and by about 4 hours, most people feel great. This is nothing more than typically Tylenol or ibuprofen would take care of. If there is any discomfort experienced afterward, that usually takes care of it. Now with PRK, it's going to take a little bit longer. PRK is a treatment, of course, done where the skin on the surface of the eye is removed and then laser vision correction is done to the surface. Because of the nature of how a PRK is going to heal with the skin moving across the cornea, it's going to take about 3 days. And it's a gradual improvement in those symptoms over 3 days, as opposed to the typical 1-day improvement with LASIK. What's the difference between LASIK and PRK? Well, essentially it's a very similar laser vision correction treatment done to the cornea. But with LASIK, it's done under a very thin flap. With PRK, it's done essentially directly on the surface of the cornea after the skin on the surface has been removed. So it's the same treatment, just in a different location. And with LASIK, we make a 100 micron flap. Typically with a laser, the flap is reflected out of the way. The laser vision correction treatment is done under the flap covers up the treated area. With PRK, the skin is removed from the surface of the eye using one of a number of techniques, and then the laser vision correction treatment is applied directly to the cornea and a contact lens is placed. The contact lens serves as essentially a band-aid to protect the eye as it's healing over 3 or 4 days. So there's no contact lens in most cases with LASIK. So same procedure, just done in a different location on the cornea.